Aaron, thank you. Well, a new report from the CDC says that suicide is the second leading cause of death among teens and young adults. And leaders from the Alpert Family Services is here with us today to talk to us about their program. We want to bring in Tamika Raleigh and Rebecca Lesser, who are both here to tell us more. So, Tamika, I want to start with you. What do parents need to know about how they can, know if their children are struggling with mental health?
Well, one of the things we wanted to highlight is that, number one, most children will not talk to an adult. They will talk to another peer. They will talk to another teen. They will tell them what's going on. So there's signs that you can kind of pay attention to, which is if your child, the grades are decreasing, right? They're absent from school. You notice that they're distant. They're withdrawing themselves from activities, from family events. You know, there's changes in their eating habits, their moods. They're indulging in substances. There's a lot of things and there's a lot of signs that you can be aware of to kind of figure that.
And what should a parent do in that moment when maybe they see some of the signs that you just listed?
Well, they can start the conversation and ask, are you okay? Is everything okay, right? We want to make sure we start the conversation. We want to let teens know that it is okay to reach out and share what's going on with them with an adult.
All right, Rebecca, and I want to ask you, why are you a part of this program?
I'm part of this program because I've really noticed, especially in school and environments around me, I've seen relationships that aren't so healthy with a lot of teenagers and their peers and their significant others. And I kind of wanted to learn a little more so I could help the people around me understand and grow as people so they don't get hurt in the process.
Tell us what you do over at the program.
So I'm a teen fellow, and in this program I go to separate schools and I will teach about certain things. So for instance, later today I'm doing a segment at Meyer about stereotypes and mental health, and I mostly teach like young kids, but I also do other programming too. So there's a mental health aspect and a relationships aspect to it.
And Tamika, one of the programs that are being done over at the center is a roundtable discussion for teenagers. Can you talk to us about that?
Sure. So what we're doing is we have this opportunity where we can get other teens to start the conversation and talk about mental health and talk about mental illnesses and also normalize it and also take away the stigma and the taboo with it. And so the goal is that we can get other teens involved, and we want to start including other stakeholders. That would mean adults, community members, and other leaders within our community to kind of figure out how we can support teens so that they understand that mental health is okay. Checking in on mental health and mental challenges is okay.
And I feel like that has even been elevated even more over the past few years with the pandemic, you know, and everything that so many people went through during COVID. So Rebecca, what have you noticed over the last 3 years when it comes to teens, you know, who are coming out of the pandemic?
I think it's had a huge effect on the mental health of teens. I think people just felt isolated for so long, and that led to a lot of other issues. So I think that's part of the reason why that new mental health segment is just so important. I think people need to understand that what they're feeling is normal, but they can also go to people for help, and that there is a support system.
Okay. How can people get involved? What kind of information can we put out there to make sure that we're reaching anyone who may need help right now?
Well, they can contact the agency, Alpert Family Services, alpertjfs.org, and we can share many resources with the community.
All right. Thank you so much, ladies, for being here and for talking to us. And we put all of that information that Tamika just told you about on our website, WPBF.com. Just go ahead and search Teen Mental Health Resources. And remember, we always want to remind people that you do not need to wait to get help. The National Crisis and Suicide Hotline is available 24/7. That number's right there on your screen, 988. If you need help, go ahead and call. Like Tamika and Rebecca said, there is nothing to be ashamed of at all. Vanessa, over to you.
Thanks, Nat.